Hello, I'm Susan Thornton, CEO of the Cutaneous Lymphoma Foundation. Welcome to our fiscal year 2017 annual report. Our annual report gives us the opportunity to share with you the impact of our programs and services. It also gives us a chance to thank everyone who helped make this year a success. As a reminder, our fiscal year began in July of 2016 and completed June 30, 2017. Before I share some of the highlights, I want to take the opportunity to acknowledge our volunteer board of directors who give an amazing amount of time and talent to steer the CLF in the right direction. And to our amazing staff, Holly, Tina, Deb, Hillary, and Bridget. Without their efforts, not much would really happen. And to all of you who generously supported our mission throughout the year with a financial contribution, or perhaps you volunteered your time. By investing in the work of the Cutaneous Lymphoma Foundation, you keep our mission alive for people around the world living every day with cutaneous lymphoma. For all of you, we are deeply grateful. Now for a few highlights from this year. In 2017, we continued hosting our signature live education programs in major cities around the US and Canada. We were thrilled to collaborate with the team at the Women's College in Toronto, again to an audience of over 130 people. While these programs are one of the cornerstones of our work, we continue to see participation increase. Folks tell us that these programs are invaluable to them, and many return again and again. With the webcasting option, people can join us from the comfort of their home anywhere in the world. This year, more than 120 people registered to participate from their home computers from many countries and states across the US. We are excited to continue to leverage technology to bring these valuable programs to more and more people, no matter where they live. Your continued support has allowed us to add value and new innovations to these integral programs. While live educational programs are important, our online information shared through the website and the Online Learning Center is an essential resource. Over the last 12 months, the website has received over 65,000 visitors. That's a lot of visits. This year, we have been working diligently to update the website so that it is easier to find the information our visitors are looking for. Whether someone is newly diagnosed or a long-time experienced patient, everyone will be able to find what they need quickly and easily. The new website also provides us with better back-end tools for keeping this site fresh and informative. Let us know what you think. We always like to receive feedback and ways we can improve. Updating, understanding, and enhancing our online capacity is only possible with your support. At the local level, our networking groups continue to grow and expand. Our volunteer group leaders have made it possible to connect individuals across the United States in Washington, D.C., New York City, Las Vegas, Nevada, Portland, Oregon, and Salt Lake City. These groups come together to meet, educate each other, and invite others to share in their journey. We are excited about the expansion of these networking groups in new cities and continue to enhance the current groups. As with all our programs, they can only thrive and grow with continued focus and support. If this is an area you are passionate about, I do encourage you to engage with us to fund their expansion. Even as the world becomes more and more dependent upon technology, there continues to be the need for printed publications. Not everyone has access to a computer. Having a packet arrive at your home, or the ability for a physician to hand materials to a newly diagnosed patient at the end of their first visit can go a long way toward calming the fear of someone newly diagnosed. Our newsletter, The Forum, reaches people the old-fashioned way, on paper, in their mailbox. Many tell us how much they appreciate and enjoy receiving and reading each issue. The Patient's Guide to Cutaneous Lymphoma is undergoing its first revision since the initial publication in 2012. Keeping all our publications up to date and relevant requires input and guidance from clinicians, writers, and our community. It truly does take a village to make sure these publications are updated to keep abreast of new information. This fiscal year, 34,297 pieces of printed literature were distributed through the mail, physicians' offices, and at a wide variety of events. That's a lot of paper. What you may not be aware of is that we supply our printed publications free of charge, including covering shipping costs to many healthcare institutions in bulk so they can provide them to their patients. Getting information into the hands of people who need it most is vital. Your donations help to cover these costs so we can provide this critical information to patients when they need them. As we wind down our Clarion's Research Award initiatives, we are looking into the next phase of research support. As you may know, Clarion stands for Curing Cutaneous Lymphoma by Advancing Research, Innovation, and Offering New Solutions. With the creation of a new Research Advisory Council led by Dr. Pierluigi Porcu and his co-chair, Dr. Christine Eischen, we look forward to developing a robust research roadmap that will leverage what we've learned through the Clarion's grant program and expand upon it. While there have been many exciting new developments in cutaneous lymphoma research over the last few years, there is still much work to do. Our goal is to enhance the support the CLF can give to move research forward, with more to come in the months ahead. We are thrilled to be able to support these dedicated investigators in their quest to learn more about this rare group of diseases and find new, innovative methods for treating, diagnosing, and improving health outcomes. With your help, we can do just that. Throughout the year, we actively raise awareness about cutaneous lymphoma and the impact of this disease on people's lives. We raise awareness through designated days of the year, including Rare Disease Day, Blood Cancer Month, and World Lymphoma Day. We are also actively pursuing the creation of a special Cutaneous Lymphoma Day in Michigan this September with the help of State Senator Steve Beda. You have helped us raise awareness about cutaneous lymphoma around the country. We invite you to join us again this year by participating in our awareness initiatives online, in your town, and with others in your community. In these challenging times, keeping our fingers on the pulse of policy and regulatory issues at the national and international level enables us to make sure that the issues facing people living with cutaneous lymphoma are included and heard. You have engaged with us as we continue to bring the issues confronting patients to the forefront of policymakers nationally and internationally. You have helped us make a difference as we continue to broaden the scope in advocacy. I encourage you to stay engaged and continue to be an active participant. Your voice makes a difference. Before I sign off on this year's annual report, I'd like to share with you an exciting opportunity to join us in our upcoming Just One campaign. The campaign will run from September, kicking off Blood Cancer Month, and run through February of 2018. It took just one doctor, one caregiver, and one very committed patient to start a worldwide community that supports, connects, and educates anyone impacted by cutaneous lymphoma. Judy Jones, one of the co-founders of the Cutaneous Lymphoma Foundation, decided to make a difference. Now it's your turn. It only takes one, just one, to make a difference. Visit our Just One webpage and learn more about how you can make a difference. One final request. Please share this report with your friends, coworkers, colleagues, and community. Tweet about it, post it on Facebook, or simply forward this via email. Spreading our message is one of the easiest ways to show your support. And again, a sincere thank you to everyone who participates and supports the work of the Cutaneous Lymphoma Foundation. We cannot do this work without you. And now it's your turn. It only takes one, just one, to make a difference. Join us. Thank you.